Welcome to the Health and Wellness Show. This is Paul Hamilton. Today we're going to be talking about allergies and the relationship to the foods we eat, inflammation, breathing, and even sleep. We're going to do this from the perspective of a doctor of naturopathic medicine. Today we have Dr. Meera Dossa with us. Welcome to the show, Dr. Dossa.
Thanks, Paul. Thanks for having me.
Oh, it's a pleasure to have you here. Before we get started in on the content that we wanted to get to today, I was wondering if you could explain or tell us a little bit about why you decided to become a naturopathic doctor in the first place.
Sure. So when I was a young girl, my mother unfortunately was diagnosed with breast cancer. So through her journey and struggles, she enlisted the help of a naturopathic doctor who became a great support for her. And so I would accompany her to her office visits with him. And as time went on, living naturopathically became a so-called way of life for us at home. So much so that my mom's naturopathic doctor became my primary care practitioner, and I would make regular visits to him for anything that I would have normally seen my GP for. Following along with that, in university, I ended up doing my undergraduate degree in nutritional science, and to me, the only profession that seemed to make sense was to continue along this path and become a naturopathic doctor. So it became a way of life for me, it resonated with me, and I applied to the program and was accepted, and the rest, as they say, is history.
That's a great story. So I was wondering, what type of conditions then do you treat in your practice?
Yeah, so I treat a whole host of conditions, and they can range anywhere from skin pathologies like eczema or psoriasis to cardiovascular and metabolic conditions such as hypertension and diabetes, to digestive concerns such as acid reflux, inflammatory bowel disease, and irritable bowel syndrome, to name a few. My philosophy is that good health begins in the gut, as this is where approximately 80% of the immune system resides, and besides our skin is our main barrier to the outside world. And so as a result, no matter what a patient walks through my door with, I kind of hone in on the gastrointestinal tract as my point of start.
So what type of training and experience have you had in your areas of expertise?
Well, aside from my 4 years of nutritional science during my undergrad at UBC, I followed that up with 4 years of study at the Canadian College of Naturopathic Medicine, and I also have additional training as a functional medicine practitioner, and finally I'm also certified in the province of Ontario to perform parenteral or intravenous vitamin therapy. As an aside, I was also diagnosed with Crohn's and colitis in 2005, and through my own struggles with inflammatory bowel disease, I've been inspired and become really passionate about gastrointestinal health. So I'm oftentimes my own guinea pig.
So you have a lot of personal experience that you apply to your practice.
Absolutely.
So I wanted to focus in on allergies. Could you give us a definition of what are allergies?
Sure. So an allergy, by definition, is a hypersensitive immune response to a substance that either enters or comes in contact with the body. Allergic reactions occur when a person's immune system reacts to normally harmless substances. Allergies are immune-mediated reactions that can be classified into two categories, the first category being IgE-mediated reactions, and the second category being non-IgE-mediated reactions. So when people think of an allergic reaction, they're typically thinking of an immediate hypersensitivity reaction, and common symptoms such as itchy eyes, a runny nose, or constant sneezing come to mind. But sometimes an allergic reaction can be far more severe. For example, someone consumes a peanut-containing product and their throat begins to close up or they break out into hives. Many of us are conditioned to think that these are the only types of allergies that can seriously impact our health, but we know now that this isn't the case. Non-IgE-mediated reactions, or what I call delayed reactions, can also seriously impact your health and can play a significant role in the development of chronic illness. So with a delayed response, reactions can take up to 3 weeks to present themselves, and they often present as an array of non-specific symptoms such as migraines, fatigue, bloating, eczema, joint pain, asthma, generalized anxiety, and that makes it quite difficult to isolate the exact and original cause of one's symptoms.
So continuing on with this, with allergies, I hear naturopaths refer to the term inflammation. So what is that, and how might that be linked to allergies?
So inflammation, believe it or not, is actually a healthy and normal function of our immune system. It's a process by which the body protects itself against a stress or a trauma and fights off what are quote-unquote called foreign invaders, such as bacteria. Inflammation can present in various ways throughout the body. For example, in the respiratory system, inflammation can result in a runny nose, asthma, or chronic sinusitis. In the digestive system, inflammation can result in bleeding stools. The process of inflammation brings increased blood flow and immune system activity to the site of infection or injury in order to help the body to heal. However, if the process becomes prolonged or chronic, other health issues and illnesses can occur, and this is where we see people presenting again with things like chronic migraines, heart disease, arthritis, ulcerative colitis, lupus, and other autoimmune conditions. With regards to allergies, as our bodies try to rid themselves of these foreign invaders, an inflammatory response is initiated with the release of histamine. As levels of histamine increase, allergic symptoms begin to present, and this is why people find relief with the use of antihistamine medications when they're suffering from classic allergic symptoms.
So then, how can the foods that people eat, how can that cause inflammation or allergies even?
So Paul, the best way that I can describe how the foods that we eat can cause inflammation and or allergies is to give you a little bit of a physiology lesson on the gastrointestinal tract, and most specifically the gut. So in the gut of a normal, healthy individual, we have cells that are stuck together by what are called tight junctions. As we bombard our system with foods that we are sensitive to, like gluten and dairy, for example, or certain medications like antacids, antibiotics, or corticosteroids, toxins in the environment that we may inhale, the consumption of non-organic pesticide-laden foods, or putting our bodies through periods of prolonged stress, we begin to disrupt our internal terrain, and these so-called tight junctions become loose. This results in the formation of gaps between the cells of the intestinal tract, which many people may now know as a leaky gut. With these gaps now present, large particles of food are able to sneak out between these gaps and enter our bloodstream, where they are not typically meant to be present. So our bodies now view these food particles as foreign invaders and mount an inflammatory or immune response to rid the body of these foreign invaders. Histamine levels rise, allergic symptoms begin to present, and we're in the whole cycle again.
That's a great explanation. Now, I had allergies as a child, but then I started to grow out of them as I grew older. What's a possible explanation of that?
Well, it's quite possible to outgrow your allergies, but it really depends on what those allergies were and how severe they were to begin with. For example, if someone were to have an anaphylactic allergy to peanuts or shellfish, it's highly unlikely that they would outgrow these allergies. Remember, everything goes back to a healthy gut. And like I said, 80% of our immune system resides in the gut. So as our immune system begins to mature from infancy to childhood to adulthood, triggers that were once common allergens may not be so offensive to your body anymore. That being said, it's not impossible for new allergies to surface once old ones have resolved. And it's why oftentimes I have patients coming into my office complaining of new allergies that previously never caused them any issues.
So I want to move on to another topic then, and that's related to breathing and the airway and sleep. Are those affected by allergies, or if so, how?
Absolutely. So as I was discussing at the beginning of our interview, inflammation in the respiratory tract can result in conditions like asthma and sinusitis. So when there's a heightened inflammatory response in the body, and that part of the body is an area of compromise for a specific individual, inflammation can result in the constriction of your bronchioles, making it difficult for an individual to breathe. There's an increase also in mucus or phlegm production, as this slimy substance is secreted in an effort to protect the inflamed respiratory tract. This in turn causes airway obstruction, and when an individual is lying down, they may find it even more difficult to breathe. This most obviously will cause disruptions in their sleep patterns. Removing potential allergens from these individuals' diets will most definitely decrease the inflammatory response in these individuals, resulting in decreased congestion, less obstruction of the airways, less phlegm formation, and as a trickle-down effect, sleep will also be less affected.
So what about the tonsils then? Are they affected?
Well, yeah, because the tonsils are a part of the immune system. They're made up of lymphatic tissue, and their main job is to produce antibodies to fight infection. So when an individual's immune system is compromised, they are likely to get sick more easily and more frequently. With recurrent infections of the upper respiratory tract, the tonsils get quite a workout and become inflamed, which results in tonsillitis. So again, my theory of a healthy gut results in a healthier immune system, a decrease in the frequency of infections, and in turn, healthy, happy tonsils.
So how would you test then for patients who have allergies?
So I test my patients for allergies using a test called the 96 General Food IgG Assessment Panel. So this is a test that involves a simple finger prick followed by a collection on a blood spot card to isolate delayed reactions to reactive foods. So as IgG food reactions can develop over a period of hours to days after the consumption of specific foods, determining food sensitivities via elimination or food journaling alone can prove difficult, and that's why a test like this kind of helps you zero in on specific allergies for people.
So then, based on the test results that you get, how might you treat a patient for allergies?
Again, like I've discussed earlier, I really like to hone in on the gut when I treat most any condition. So when it comes to treating allergies, my approach is no different. I like to use what I call the 4R gut restoration program, with my main goal being to seal up the tight junctions of the gut. And I'll take a minute, Paul, to explain to you what that's all about. So the first step for me is to remove offending agents or allergens, which I'm able to determine through the testing that I just described. Once I've removed those offending agents, I move on to the second R, which stands for re-inoculation. More simply, this means providing the gut with beneficial bacteria, such as Lactobacillus acidophilus and Bifidobacterium. The next step in this process, or the third R, involves restoration. At this point, I want to restore things that may be missing, such as digestive enzymes and stomach acid, as many people tend to have lower than normal stomach acid levels as a result of long-term antacid use. Low levels impede the digestive process and allow the larger than normal food particles to make their way through the intestinal tract. The final step in this process, or the last R, involves repairing the gut. I do this with the use of specific vitamins and amino acids to help with internal wound healing, as you have essentially created a wound internally with the breaking of the tight junctions. These nutritional supplements also aid in the rejuvenation of the lining of the gut, creating a new and healthy internal terrain. Once this internal barrier is back intact, most of my patients start noticing a reduction in their allergic symptoms as food particles are no longer able to make their way past the tight junctions and into the bloodstream, creating a heightened inflammatory response.
So we've just talked about your approach to treating allergies, but then how can overall wellness be improved with your approaches?
So again, regardless of what a patient walks through my door with, my focus is always on optimal gastrointestinal health. And a healthy gastrointestinal system is the foundation of good health, and when this system is in balance, I believe that all other health parameters improve as a result.
Do you have a couple of handy tips then for people who have allergies?
Absolutely. The first thing I would recommend is to keep a diet diary or a food log of what you're consuming and how you're feeling after you're consuming these things. Oftentimes it's difficult to make that correlation between the foods you're eating and how you're feeling because symptoms don't present immediately. Keeping a log will help you to recognize patterns between the consumption of certain foods and the onset of specific symptoms. Another good general tip in terms of diet is to consider the elimination of the most highly allergenic and genetically modified foods, those being things like wheat, dairy, soy, sugar, and corn. And in addition, if you suffer from any chronic inflammatory condition, so that's any condition ending with the suffix itis, so things like arthritis, colitis, etc., you can also consider the elimination of the nightshade family, which would be things like tomatoes, potatoes, eggplant, bell pepper, as these are considered to be pro-inflammatory and they will increase internal inflammation.
Those are some really helpful tips. Now, I think you're creating a case for people wanting to visit a naturopath. What should somebody look for when they're looking to visit a naturopathic doctor?
So it's really important to ensure that your naturopathic doctor is in fact registered with the Board of Directors of Drugless Therapy Naturopathy, or for short, the BDDTN, in order to practice in the province of Ontario. Being registered with the BDDTN ensures that your naturopathic doctor did indeed graduate from an approved School of Naturopathic Medicine and also successfully completed the Naturopathic Physician's Licensing Examination and the Ontario Board Examinations. If you want to verify your ND's registration, you can simply log on to bddtn.on.ca, and you can view the list of registered naturopathic doctors right there.
Ah, that's terrific. Now, if listeners wanted to get in touch with you specifically, what's the best way that they can do that?
Absolutely. First of all, thanks for having me. And then if they wanted to get in contact with me, they can do so by emailing me directly at rosedalenaturopath@gmail.com, or they can call my office line at 647-705-1242 directly for more information. And finally, I have a little bit more information about myself and the services that I offer available on my clinic website, which is www.davisvillehealth.com.
Terrific. Dr. Dossa, I'd like to thank you very much for the time you've spent with us today and the expertise you provided and all the great insights. I want to thank you very much.
Thanks so much again for having me, Paul.
Thank you. Bye-bye.